Hello, my name is Margiolis Blanco. I'm a psychology student from Houston Christian University, and I will be discussing Alzheimer's disease, focusing on its prevalence, clinical features, treatment options, and the experiences of caregivers. This presentation will provide a comprehensive overview of both the medical and personal aspects of the disease. Alzheimer's disease is a degenerative brain disorder that progressively impairs memory and other cognitive functions, eventually developing into dementia. According to the Alzheimer's Association 2025, 6.9 million Americans aged 65 and older are living with Alzheimer's today, and that number is projected to nearly double to 13.8 million by 2060. Nearly two-thirds of those affected are women, and the disease disproportionately impacts Black and Hispanic Americans, who are about 2 times and 1.5 times more likely, respectively, to develop Alzheimer's compared to white Americans. On average, survival after diagnosis ranges from 4 to 8 years, though some live up to 20 years. Alzheimer's currently ranks as the fifth leading cause of death among Americans aged 65 and older. In 2022, approximately 11 million unpaid caregivers provided an estimated 18.4 billion hours of care, which is evaluated at nearly 347 billion. By 2025, Alzheimer's and other dementias are projected to cost the U.S. 440 billion, including healthcare, long-term care, and hospice. The financial impact on public programs is significant. Medicare costs for people with dementia are 3 times higher, and Medicaid costs are 23 times higher compared to individuals with dementia. The symptoms of Alzheimer's can vary from one person to another. Typically, the first signs of Alzheimer's are memory problems, which later decline into cognitive issues. In terms of onset, there are two categories. Early onset, which happens around age 30, it is very rare. And the second one is the late onset, which happens around the mid-60s. This is the most common form. In terms of clinical progression, 4 stages have been observed. The preclinical stage is when the first changes in the brain, such as amyloid plaques and tau tangles, begin to appear. These changes can occur more than a decade before memory problems emerge, and not everyone who develops them goes on to develop dementia. In the mild stage, the person may seem healthy, but starts having trouble making sense of the world around them. Symptoms may include memory loss and confusion, including repeating questions and forgetting recently learned information, impaired judgment and problem solving, leading to poor decisions and difficulty handling money, disorientation, such as losing track of dates, locations, or wandering, challenges with daily activities, including bathing, completing tasks, and misplacing items, mood and personality changes, including anxiety, aggression, and loss of initiative. In the mild stage, more intensive supervision and care become necessary. Symptoms may include worsening memory and confusion, increased forgetfulness of events or personal history, and persistent earlier memory issues. There is also cognitive and language decline, which can look like difficulty learning new things, organizing thoughts, using language, reading, writing, and working with numbers. Behavioral and emotional changes, which include withdrawal from social activities, inappropriate emotional outbursts, impulsive behavior, restlessness, agitation, and anxiety. There is also daily functioning challenges such as trouble carrying out familiar multi-step tasks and coping with new situations. Disorientation may include occasional problems recognizing family and friends. There is also severe perceptual disturbances such as hallucinations, delusions, paranoia, repetitive statements or movements, and occasional muscle twitches. Changes in sleep patterns may also occur. In the severe stage, people in this stage cannot communicate and are completely dependent on others for their care. The person may stay in bed most of the time as their body shuts down. This happens toward the end of life. Symptoms often include severe communication loss, which may look like inability to communicate and lack of awareness of surroundings. Physical decline, such as weight loss, difficulty swallowing, and general health problems such as dental, skin, and food issues. There is also motor and neurological symptoms such as seizures and abnormal sounds such as groaning and grunting. There is loss of bodily control, such as increased sleeping and loss of bowel and bladder control. And there is also complete dependence, full reliance on others for basic care and daily needs. Doctors use several approaches to determine whether a person's memory or thinking problems are due to Alzheimer's disease. They begin by gathering detailed information about the individual's health history, daily functioning, and any recent changes in behavior or personality, often including input from family members or close friends. To assess cognitive abilities, doctors administer tests that measure memory, problem-solving attention, and language skills. Standard medical tests such as blood and urine work are also performed to rule out other possible causes of the symptoms. In addition, a psychiatric evaluation may be conducted to identify whether conditions like depression are contributing to the difficulties. More specialized procedures such as collecting cerebrospinal fluid to check for Alzheimer's related proteins can provide further evidence. Finally, brain imaging techniques, including CT, MRI, and PET scans, are used to support the diagnosis and rule out other neurological conditions. The concept of dementia dates back to ancient times, with thinkers like Hippocrates attributing age-related mental decline to brain changes. In the late 19th century, advances in brain histology and staining methods enabled physicians to correlate mental symptoms with physical brain changes. In 1901, Dr. Alois Alzheimer encountered a patient who exhibited memory loss, behavioral changes, and confusion. After her death in 1906, he examined her brain and described abnormal plaques and tangles. Emil Kraepelin adopted Alzheimer's findings into his 1910 psychiatric textbook and formally named the condition Alzheimer's disease, initially classifying it as a form of pre-senile dementia. In the mid-20th century onward, researchers identified additional contributors. More recently, Alzheimer's has come to be understood not just as a clinical syndrome, but as a decades-long pathological process, prompting efforts toward earlier detection and prevention. Alzheimer's disease is characterized by an accumulation of neurofibrillary tangles and neuritic plaques in the brain. This abnormal formation caused loss of neurons in the basal forebrain and the neocortex. Based on these pathological findings, two main hypotheses have been formulated: the cholinergic hypothesis and the amyloid hypothesis. This last one is the most accepted theory, proposing that abnormal processing of amyloid precursor protein produces toxic amyloid beta peptides. These peptides accumulate, form plaques, and damage neurons. When it comes to Alzheimer's disease, there is currently no cure, so treatment mainly focuses on managing symptoms and slowing progression. Two main types of medications are used. The first are cholinesterase inhibitors such as donepezil, rivastigmine, and glutamine. These drugs work by boosting acetylcholine in the brain, which helps with memory and thinking, though they can cause side effects like nausea, diarrhea, and even heart rhythm problems. The second option is memantine, an NMDA receptor antagonist that helps protect the brain cells from excess calcium buildup. Memantine is usually prescribed in moderate to severe Alzheimer's and can also be combined with cholinesterase inhibitors for added benefits. In recent years, disease-modifying therapies have emerged. These are monoclonal antibody treatments designed to remove amyloid plaques from the brain. For example, aducanumab was approved in 2020, followed by lecanemab in 2023, which shows about a 27% slowing of disease progression. Donanemab is also expected to be approved soon, showing a 35% slowing of the decline in trials. However, these treatments can cause side effects called AREI, swelling or bleeding in the brain, especially in patients with certain genetic risks. Beyond medication, it's also important to manage behavioral and psychological symptoms like anxiety, depression, or agitation. SSRIs may be used for depression, while antipsychotics are reserved for severe cases of agitation. In 2023, the FDA approved brexpiprazole, especially for agitations in Alzheimer's dementia. Non-drug strategies are also very helpful, creating safe and familiar environments, redirecting attention, and establishing healthy sleep routines. Finally, regular aerobic exercise have been shown to help slow progression and improve quality of life. The BBC documentary Alzheimer's: What You Can Do highlights that while there is no single cure for Alzheimer's, there are many ways we can lower the risk or delay its onset by focusing on prevention. The video emphasizes that brain health is shaped by daily choices and several lifestyle strategies can make a meaningful difference. The following are all good practices that can help lower the risk or even delay symptoms. Maintaining strong social interactions and staying socially active, adopt a healthy nutrient-rich diet, engage in regular aerobic exercise, monitor and reduce stress levels, ensure good quality sleep and hygiene, cultivate mentally stimulating activities and continuous learning, and finally, a holistic combination multi-factor approach is like the best way to approach all of these lifestyle changes, not just relying on one intervention, but combining all of them. Living with Alzheimer's can be a disorienting emotionally turbulent, and deeply humbling experience, according to Deborah Good, who shares her day-to-day life after diagnosis. She says that you may wake up without knowing the date, what date it is, or what your schedule was supposed to be. Everyday tasks feel confusing, trying to dress, make coffee, remember if you have already fed the pets, or locating items in familiar spaces become difficult. Moments of memory may come and go, reading the same article multiple times, forgetting what the doctor said hours after the appointment, or being unsure of what you ordered at lunch. Emotionally, there can be waves of anxiety, sadness, confusion, frustration. Some days may feel lonely or scary. In relationships, the person with Alzheimer's may still connect through emotions even if memory fades. Music, kindness, and presence matter more than perfect recall. The loss of autonomy is a constant tension, needing a system with tasks that once were effortless, depending more on loved ones, and navigating the grief of shrinking independence. Sleep and rest become less restorative. Nights are fragmented, waking happens, and exhaustion persists. Caring for someone with Alzheimer's can be both physically and emotionally demanding. Caregivers often face psychological stress, social isolation, and health challenges, including sleep problems, fatigue, and increased risk for illness. They may also experience financial strain while managing the day-to-day responsibilities of care. Behavioral symptoms in the person with Alzheimer's, such as agitation, wandering, incontinence, or repetitive talking, add to the complexity of caregiving. Despite these challenges, understanding these demands and seeking support can help caregivers manage the stress and maintain their own well-being.